Hello there. Thanks for joining us for this Wednesday's edition of Jamaica Magazine. Boy, do we have a lot in store for you. First up, we take a look at the tourism estimates of expenditure for this fiscal year. And later,
Go for the gold! Get vaccination. We were vaccinated. We were vaccinated. Are you vaccinated? Get vaccinated.
yes, you've guessed it, we'll talk vaccination. You don't want to miss what we have packaged for you today, so stick around.
Good day, I'm Andrea Chisholm and this is your JIS News for Wednesday, April 27. Prime Minister Andrew Holness says government will be sparing no effort in the fight against crime and violence in the country. He was speaking against the background of a triple murder in Montego Bay on April 22. Mr. Holness said crime would be dealt with using two parallel strategies.
Clearly, the police have operational responsibility and we continue to support them with resources in this regard. We have a platform. We have a platform to appeal to the people who live in these communities that violence and murder is not the only way to resolve conflicts.
A national cleanup program got off to a start in Montego Bay on the weekend, setting the framework for other sections of the island. Led by local government and community development minister Desmond McKenzie, the program targeted communities in St. James which had a pileup of solid waste. The exercise cleared away large old household appliances, old vehicles and other items which were no longer useful.
And within the first 2 hours of the exercise, we have removed more than 20 loads, truckloads, have gone to the dump.
Minister McKenzie says the intervention will be further intensified.
Jamaica need a clean environment because the growth agenda of the government requires that we welcome investment into the country, and Montego Bay is the tourist capital of the island, and we have started here so that we can send the signal to the wider Jamaica about the commitment of the administration as far as beautification, cleanliness is concerned.
The National Cleanup Program is supported by the Ministry of Health, Social Development Commission, the National Solid Waste Management Authority, National Works Agency, parish councils, the military and police. Meanwhile, Prime Minister Andrew Holness has called on the citizens of Montego Bay to take a personal interest in keeping the city clean and attractive to visitors, investors and locals.
Montego Bay is the portal for much of Jamaica's investment. It is literally a gateway into Jamaica. And for many years, the town has been growing, expanding with all the opportunities available in business process outsourcing, in tourism. And it has attracted a large population around those opportunities.
Mr. Holness was speaking with JIS News during a tour of sections of St. James on Saturday. He hailed the 2-day cleanup of the city, which forms part of government's Zika virus intervention. And taking note of new developments and the growing population in the parish, the Prime Minister said social and civil infrastructure such as drains and waste disposal would get priority attention.
There is real need for intervention, and we will be intervening in an immediate and positive way to bring a change to the lives of the people who live in these areas. Housing will be a critical focus for us. Community development, a critical focus.
Jamaica and Cuba have agreed to concretize a multi-destination marketing arrangement along with the Dominican Republic. Tourism Minister Edmund Bartlett says the country should sign off on the official Memorandum of Understanding in May. The announcement comes after the recent meeting with Cuban Ambassador to Jamaica, His Excellency Bernardo Guanche Hernandez. The United States remains Jamaica's largest tourism market, and with Cuba coming into the mainstream of economic activities, Minister Bartlett believes now is the right time to formally implement this crucial partnership.
Now we can look at, in the first instance, a tripartite arrangement between China, Jamaica, and Cuba. And in the second instance, a tripartite again arrangement between Jamaica, Cuba, and the Dominican Republic.
Minister Bartlett has been invited to Cuba to meet with the country's Minister of Tourism to formalize the arrangement. And finally, government plans to spend $1.3 billion this fiscal year to increase its fleet of Jamaica Urban Transit Company JUTC buses. $500 million will be used to complete the acquisition of 35 Chinese buses for use on the hilly routes of St. Andrew. Another $799.4 million is to pay for spare parts and special tools for the JUTC acquired during the last fiscal year. The remaining $10.3 million will be used to complete the feasibility study for the Portmore Transportation Hub initiative, which commenced during the 2015-2016 fiscal year. And that's it for GIS News today. Amandra Chisholm, thank you for watching.
Let's get a little breeze on this land. All right. Now let's get some bounce in the rhythm. All right. Let's get some fire on our hearts. Now that is what we call all right. Run, come, get some Jamaica.
Jamaica is one of the most sought-after countries for tourist vacations each year, and that's why the government has plans to implement numerous projects that will push for an even greater increase in our annual tourist arrivals. Here's a look at this year's tourism estimates of expenditure.
The Ministry of Tourism has been allocated more than $1.7 billion in the 2016-2017 estimates of expenditure. Most of that is going towards recurrent expenditure or housekeeping expenses, while $17 million is part of the ministry's capital budget for development projects. The ministry's budget will be supplemented by $3.49 billion in grants from the Tourism Enhancement Fund, income from the industry training programs, and inspection fees. Among other things, that money will support the work of the Jamaica Tourist Board, Jamaica Vacations Limited, and the Tourism Product Development Company. The Tourism Enhancement Fund will also be providing nearly $2.9 billion to market brand Jamaica overseas. The mission of the Tourism Ministry is to work with its partners to establish policies, programs, and systems that will add value to the rich, unique, and varied attributes of the country. As such, the work of the Tourism Linkages Hub will continue to be of top priority in fiscal year 2016-2017. $26 million have been set aside for projects under this initiative.
We have to protect them. We have to create this catchment to allow for all the people who are working within the industry, directly or indirectly, can have some social security protection.
In fulfilling that mandate, the ministry is to spend $2.5 million for the Pension Planning Education Program. This will create a sustainable pension program for workers within the sector. In the 2016-2017 legislative year, the development of heritage sites will also be of top priority. $48 million will be provided to offset the operating costs of the Devon House Heritage Site, Milk River Hotel, Spa and Bath, and Bath in St. Thomas. The Tourism Ministry's entire capital budget of $17 million will be going towards one project this year. It's called Enhancing the Resilience of the Agricultural Sector and Coastal Areas and is being financed by the Adaptation Fund. The implementing entity is the National Environment and Planning Agency, and the main objective is to protect livelihoods and food security in vulnerable communities. That will involve improving land and water management for the agricultural sector, strengthening coastal protection, and building institutional and local capacity for climate change adaptation. The Ministry of Tourism, building brand Jamaica, pulling millions of visitors to the country while contributing to reduced poverty levels and greater social inclusion in the 2016-2017 fiscal year.
Keep we island clean, so clean. From the peaks to the beach, so clean. No dirty up Jamaica, please don't do it. Keep we island clean, so clean. From the peaks to the beach, so clean. No dirty up Jamaica, please don't do it.
No dash no paper, no dash no plastic. Dispose your garbage responsibly. No know how to recycle, learn it quick. And if you drop it, better pick up every piece of it. Plastics last forever, don't forget the bits. Cause when them touch the street, them end up in the sea. Collect pan the reef where they fish them feed. And when you want seafood, I eat your
Keep
eat.
we island clean, so clean. From the peaks to the beach, so clean. No dirty up Jamaica, please don't do it. No dirty up Jamaica, no dirty up Jamaica, no dirty up Jamaica, no dirty up Jamaica.
The 14th Vaccination Week in the Americas 2016 is being celebrated now. It actually started last weekend and will continue until this Saturday, April 30. During this period, lots of activities are taking place to remind us of the importance of getting vaccinated, boosting our immune system. Learn more from this special Issues and Answers interview.
Thanks for joining us for Issues and Answers. I'm Ian Boyne. It's Vaccination Week, and Jamaica had the honor this year of having the director of the Pan American Health Organization, Dr. Carissa Etienne, launch this week. And it is our honor to have her in our studios on Issues and Answers. We thank you so much for your company. Dr. Etienne, good to have you in our studios.
Thank you so much for the opportunity.
Here. Vaccination, why is it important? There's still some resistance, not much, but some skepticism about vaccination. Why is it critically important?
Vaccination is important because it saves lives. Basically, millions of lives. It prevents really some major diseases, and we are able to administer it, not at no cost, but certainly within the investments in health, we are able to manage vaccinations. Over the years, we've been able to cover 95% of the population.
And Jamaica is not doing badly at all.
No, Jamaica is at 95%. There are now some 20 diseases that can be prevented from vaccination. And because of vaccination in the Americas, we've eliminated measles, we've eliminated polio, we've eliminated rubella and rubella congenital syndrome. Of course, smallpox was also eliminated. Mm-hmm. So these are diseases that don't occur here again. At all. And we were the first region to do this.
And measles occurred not too long ago in the United States.
And it is because of the vaccine hesitancy that certain population groups in the United States do not wish to be vaccinated, particularly with measles, mumps, rubella, because they claim that there might be a link with autism,
yes,
and so they don't vaccinate. And so there were a number of children who were not immunized against measles, and so we got an outbreak there.
What's your response to this argument? It is gaining more and more currency that vaccination is connected to autism.
Well, there is no evidence of it. People have written in the social media about it, but there is no sound evidence.
So why is this the persistence of the suspicion?
Because those who feel strongly about it are very loud.
Yes.
And they write prolifically about it, and it resonates with some members of society. And frankly, with the celebrities, the more affluent types in the society. But also in the Caribbean, we've had some hesitancy from the Rastafarian movement.
Yes.
But
and some fundamentalist Christians too.
Yes. But you know, in a way, we've worked with these
Groups.
communities to help them accept immunization. I remember in Dominica, we had diphtheria in a child from a Rastafarian community. Now, diphtheria we don't hear or see diphtheria.
Yes.
And we had to work with them and to get the kids immunized.
But PAHO is willing to work with various groups, to interact with them, to share the knowledge that it has with groups that might be hesitant.
Certainly, that's why the Secretariat exists, and we work with all of our member states with particular emphasis on those who are lagging behind. We help with procurement. We have the Vaccine Revolving Fund where we pool the demands from all of our member states and we negotiate prices. At one time, PAHO got the lowest price. We negotiated, we will only buy at the lowest price that you sell to anybody. And so that assisted a lot in making vaccines more affordable for many of our member states. We work with our member states to be able to decide on the demands, to forecast the demands. We give technical cooperation and guidance for actual vaccination programs. And we set up with member states the surveillance for ill effects and side effects of vaccines. So we are very, very involved.
Good. There are other health issues that we need to talk about when we come back from our break. We're speaking to the director of the Pan American Health Organization, Dr. Carissa Etienne.
Be vigilant. Keep yourself H1N1 free. Take a flu vaccine. Stay away from sick persons or large crowds. Wash hands frequently with soap and water. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth, and cover your mouth when sneezing or coughing. Keep yourself H1N1 free. Your health is your responsibility.
Welcome back. We're speaking to the director of the Pan American Health Organization, Dr. Carissa Etienne. The H1N1 Zika threat is of major concern in the region and certainly in Jamaica. Tell us of PAHO's role in...
So let me separate the two. So
Yes.
let's talk about Zika. Zika emerged in Brazil sometime in May of last year. And since then, we've seen 35 countries in the Americas having active Zika transmission. Of course, you know, Zika is caused by transmitted through the Aedes aegypti, Aedes albopictus mosquito, which we have very high infestation rates in the region. And so we expect to see Zika taking root in many of our countries in the region. Normally, Zika is a mild infection, but in the Americas, we are seeing an increasing number of Guillain-Barré syndrome, which causes paralysis. Most people recover from this, but more importantly, it's the effect of in utero, the fetus, no? And we are seeing severe neurological deformities. The microcephalia is a sign of the damage that has been done to the brain. But it's not just microcephalia, it's a range of symptoms. Okay. And so we are seeing increased epilepsy, we are seeing eye problems, we are seeing irritability, and we are still documenting what are some of those effects. And PAHO is active in all of the countries. We have made some 28 missions to countries. We've strengthened their laboratory capacity, strengthened their surveillance capacity. We've worked on guidelines for managing both Guillain-Barré syndrome and the microcephaly and the neurological conditions in neonates. But as well, there are lots that we don't know. We don't know why Zika is causing so much microcephalia. At first, we had to establish that there was a connection. There was a causal relationship, which we have. So there is also a research agenda that PAHO has worked with other partners to define and to support that research. I think also it's what do you do about the mosquito? We've been fighting this particular mosquito for many years. It causes dengue. It transmitted chikungunya virus,
Yes.
and also now Zika. And in many of our countries, we have simultaneous transmission of Zika, of dengue, and of chikungunya.
Yes.
And we are now looking, and PAHO has said that it is available to accompany countries in piloting these innovative approaches to reducing the mosquito population.
Okay.
And that's another thing that we
Yes.
will be doing.
And-
H1N1. H1N1 is preventable. So there is a vaccine for H1N1, and some countries have gone on an approach of a blanketing immunization for all people.
Yeah.
We recommend for countries where there is a budgetary issue that you do your targeted,
groups.
right?
Mm-hmm.
Healthcare workers are susceptible, they're vulnerable, at-risk population, pregnant women, those who are immunocompromised, so we advocate for. The problem is that the vaccine is not 100% efficacious. Right? So not everyone who will take, first of all, if you take the vaccine, that does not mean that you will not catch the flu.
There's no guarantee.
No guarantee.
Yes.
But even though if you have the vaccine, the chances are if you catch the flu virus, then it won't become very significant, your illness. Because we see deaths with H1N1. But you know, we've also observed the vaccine hesitancy among healthcare workers. Who are the most at-risk group,
Yes.
and they don't want to take the H1N1 vaccine.
Because they have concerns.
No, I think if you ask me, I think healthcare workers, we care less about ourselves. So most of us are afraid of injections.
That's a revelation. Dr. Etienne, primary health care. I know this is one area that you have put a lot of stress on. Why is primary health care so important?
Well, primary health care is important when it's organized properly and when it's done properly, in that it involves the community. It works in the community and with the community. It makes access to healthcare available right close to where people live. It is therefore more sensitive to their needs. It is more cost effective. To treat someone in a health center or health clinic is much cheaper than treating them in hospital for the same. It emphasizes prevention. It emphasizes comprehensive care. But I think also importantly, it's the community must get involved in defining and solving its same issues. And so it sort of presents that opportunity for communities to do this at their community. We found that there is, well, in 2006, I led the renewal of primary health care in the Americas. I did the same in Geneva some years later when I was the Assistant Director General there. And there is a significant movement now towards improving primary health care. And we see countries reorganizing their health systems with health clinics. But the important thing is you need to improve the ability of the health centers to resolve some more complex issues.
That's right.
So if you go to the health center and then you can't get your lab work done,
true.
you can't get an X-ray.
People are going to be forced to go to the hospital.
So they just bypass the health
That's
center.
right.
But if you improve the technology there and you make it that people can go there and they are assured of getting care, that their waiting time is much less, then people will choose to go to their primary health care centers.
Finally, Director, universal access. There are countries like Jamaica challenged with their budgets. Why is universal access still important despite budgetary constraints?
Because, and I am a great advocate for universal health coverage and universal access to health. Frankly, I led the movement in Geneva, and when I came to PAHO, we got member states and we've worked with member states, so we have a resolution. So all of the countries of this region are committed to universal health coverage and universal access to care. But you hit the nail on the head. How are you going to finance it? But the truth is that many countries in the world achieved universal access even when they were low middle income countries. So it is the political will. It is the will to say that we are going to either through taxation or either through national health insurance, that we are going to reduce paying at the point of service. So the worst thing that can happen is if cost is associated with care. So when you are ill and you have to go to a healthcare facility, if you need to pay, that is the biggest barrier to accessing care. So we have to look for mechanisms to pool those resources prior to, and people can contribute to that pooling. So resources are available for the health service. But importantly, there is always a percentage of the population that will not be able to pay.
That's right.
And governments have to be responsible for this.
Government must take responsibility
for this. Because we also associate this access to care with human rights. And this is enshrined in the WHO Constitution, in the PAHO Constitution, that people have the right to access for care.
Of course. Yes.
And that's very, very important.
Absolutely. Also enshrined in United Nations.
Exactly.
Charter.
And in many of our constitution, many countries in their constitution as well.
Absolutely right. Interesting talking with you, Dr. Carissa Etienne, Director of the Pan American Health Organization. We thank you for your company on Issues and Answers. Next week, we'll be back. Until then, Ian Bourne wishing you a pleasant day.
Who should be vaccinated? Babies, children, young people, old people, black people, white people, all people. Go for the gold. Get vaccinated. What is the aim of vaccination? Vaccination prevents diseases. Measles, mumps, and rubella. We not have that. Smallpox. We not have that. Polio. We not have that. We were vaccinated. We were vaccinated. Go for the gold. Get vaccinated. Want to be fast like gold? Go for the gold. Get vaccinated. He was vaccinated. Shillian Fraser Price. She got it right. She was vaccinated. She was vaccinated. Go for the gold. Get vaccinated. For a healthy nation, keep the focus on vaccination. Let's teach it. Let's preach it. Vaccination saves lives.
We've come to the end of the program. If you enjoyed what you saw on today's pages, please share your comments. Send your feedback to jamaicamagazine@jis.gov.jm. And if you just want more information, cultural entertainment, more, follow us on Twitter @JIS News or browse our website jis.gov.jm. I'm Theodore Henry. Do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.